All right, so your blood pressure today was 142/88. This is a little bit higher than we like to see, especially considering that your baseline throughout your pregnancy has been about 110/70. This is a little bit higher than that, and we've seen it creeping up over the weeks. So I think we should have a conversation about that. Hypertension is a common complication in pregnancy. It affects roughly 2 to 10% of pregnancies throughout the world. And the higher blood pressure makes me concerned for preeclampsia, which can lead to eclampsia and HELLP syndrome and several other hypertensive disorders as well. All of these disorders are the leading cause of mortality for moms worldwide. The upside is that testing and treatment really increase the likelihood of healthy moms, healthy babies, and vaginal birth, which is what we want. So, to diagnose, we need officially 2 readings 4 hours apart that are 140/90. So, I'd like to see if you could come back and we can get a second reading later. Great. So, time out. This client would then come back a couple of hours later, maybe after work or something. All right, so now having that conversation with the client. Okay, great. Your blood pressure has come down just a little bit, so I'm not worried that we need to call a doctor right now. But I am still wanting to, kind of have this in the back of our mind that this is going on. And I would also double checked earlier about other symptoms such as a headache that won't go away with Tylenol, pain on the right side, kind of under your ribs, and visual disturbances, black spots, floaties, waviness, anything like that. So today I would like the client to pee on a urine dipstick and run that little test just to see if there's any protein there. And I would like to talk about some follow-up testing. Either way, I think it would be appropriate to do a blood draw and check your CBC and liver function, just to kind of see what those numbers look like, because it'll take a couple of days to get those readings back. So if your reading is normal, so I think that we're good to go. So I think let's do some blood tests and just see about that. In the meantime, I have some supplements that I would love for you to take. If there is a problem, they're helpful, and if they're not a problem, I really feel like they're helpful too. One of them is calcium at 15 to 2,000 milligrams a day, garlic, hawthorn berry tea, 1 cup a day, chlorophyll, and I know it's easier said than done, but anything that you can do to reduce your stress is also really helpful. If the readings are elevated and your lab results are normal, that would be an indication to consult with an OB here in Washington. Or, of course, if any of the other warning signs become a problem. I need you to let me know if you have a headache that doesn't go away, if you're having any weird visual stuff happening, or if you get pain in that right side. Let me know about that as well. In Washington, it is, if we get those 2 blood pressure readings that are 140/90, I need to refer you to an OB. And in the meantime, I think we see what your labs say, and I think that it would be appropriate to do a non-stress test kind of twice a week, just to make sure that baby's doing all right in there. We can do that NST here in the office. That's just hooking you up to a monitor for 20 minutes and just following baby's heart rate to make sure that everything is going well. And we'll just continue testing your blood pressure and checking for protein in your urine, and just make sure baby's growing healthy. Do you have any questions? All right, no questions. Something else that I may consider is dates, and there's a formula called Gentle Birth Formula that can just kind of help prep your body to get ready to have a baby. in case that's something that we need to do. But until then, I think let's just stick with this plan and see how everything goes.